Hey everyone, Ali here. So it sounds like you're ready to buy a practice. That's why you're watching this video. Well, I'm going to go through the top three things to avoid to be able to buy your practice successfully. So buying a practice is not hard to do. It's not hard at all. Banks will give you money. Everyone will encourage you to buy it because it is a wonderful thing to become a business owner. It is a wonderful thing to own your own practice and control your destiny in that situation. But to do it correctly, to minimize your risks, you got to do three major things that a lot of people avoid. Okay. And those are the three due diligences. So the first due diligence I call the financial due diligence. And this is where you have a CPA and the bank analyze all the practice data. I'm sorry, not the practice, the tax returns, the financial data of the practice, right? So they're looking at tax returns, P&Ls, they're looking at all those details and making sure everything is lined up. Okay, that's financial due diligence. Then there's legal due diligence. That's my part, right? So I look at the purchase contract, I look at the lease, we set up your corporation, help hire the employees, make sure all those documentations are in place. The final and third due diligence that a lot of people don't do and they should be doing is what I call practice management due diligence. Here, you have a consultant help you analyze the practice data, right? They got to know what is going on within the practice. What's the DNA of the practice? And this is important because this is where you really learn all about the office. And if you don't do this, it's kind of like buying a used car without getting a mechanic to check it out. And the best consultants, what they'll do is they won't just tell you what's wrong. They'll also tell you where the opportunities are in buying this practice. There may be things that the seller is not doing that you can do immediately upon purchase that will help you, increase your profit and increase your revenue. The reason these three things are sometimes ignored or not really focused on is because these practices move quickly. There's a lot of buyers, not a lot of sellers in the market. And so there's sometimes this urge to just kind of move forward quickly and overlook some things. But if you do those three things, then you will absolutely be minimizing your risk. And every doctor that we work with, we walk them through these three scenarios and we make sure they do these with independent folks, somebody who's experienced on the CPA accounting side, a bank that is in the industry. Obviously they're using us on the legal side. So we've got, protecting them there, but using a consultant that's good. And not all consultants are good. And so you want to really focus on somebody who does these on the acquisition side so that you get the data you want. So if you have any questions, let me know. But remember, make sure you do those three due diligences for every transaction that you do. It's money well spent because remember, with a transition, you're relying on the seller and the information they're giving you. So you've got to verify everything. If you have any questions, let me know.